5,000 babies a year. Our commitment to provide high-quality women's health care is evidenced by our teamwork, our councils, and our leadership. We are committed to delivering care that is non-biased, evidence-based, and empathetic. In today's healthcare setting, our high-risk population has increased exponentially as healthcare needs become more complicated. In the past year, we have faced unusual complications such as splenic artery rupture, stroke, maternal cold, flash pulmonary edema, SVT, torsades, grand mal seizure, all congruent with an increasing population of morbidly obese patients. Each of these situations resulted in the delivery of a stable newborn. Our nurse manager and recently appointed Associate Director, Mary Shanahan, as well as the Director of Women's and Children's Services, Carol Schwall, have been paramount in inspiring us to build a quality infrastructure. We are incredibly proud of our growth this past year. Shared governance is supported and nurtured through peer review, quality improvement, evidence-based practice, collegial teamwork, and nursing research. We have created a team that is completely engaged and involved. This positive snowball effect has allowed nurses to be creative and expressive in adapting a comprehensive approach to workflow. It has provided those at bedside with a voice to improve patient safety as well as the ultimate labor and delivery experience. Our growth has taken us into collaboration with multiple entities within the Abington Health community. Next.
Special consideration is warranted for our high-risk surgically and medically compromised patients. Multiple specialties convene to discuss and implement a plan of care to prepare for their arrival on our unit. The goal is to create a methodical and systematic approach that we can use to care for these patients. The team meets monthly and involves all the disciplines and subspecialties participating in the patient care. The nurse practitioner on our unit coordinates appropriate records, labs, and radiology reports and enters appropriate information into the patient database. An easy-to-use checklist was implemented that would clearly communicate the plan to anyone involved in the patient's care. The process continues to be refined, and all specialties participating in this process can see how a shared vision of patient care works to achieve a higher level of medical care. Patients who are aware of this collaborative approach have expressed feelings of increased confidence in their care. As a unit, we look to cost containment with an efficient, effective nursing process without compromising our patient satisfaction. The induction task force was developed with this in mind. We are working at optimizing admissions to streamline the labor process for women. When given the ability to make decisions on workflow, both our nurses and our patients benefit. We recognize the need for a staffing committee to emphasize that our home life is as important as work. Although self-scheduling is complicated and time-consuming, it is necessary for staff satisfaction. Our 6-member committee complies with the needs of the unit and addresses staff requests.
Unfortunately, not every family receives joyful news during their pregnancies. Our staff is educated in perinatal loss in order to support the families that suffer the life-altering loss of a child. It is a collaborative effort of nursing, social service, and pastoral care. Our care does not stop at discharge. Our perinatal loss committee offers support services to assist in the healing process. And in the coming year, memorial services will become a part of our healing process. As one could imagine, the birth of a child encompasses all aspects of human existence. It is a physical, mental, emotional, and intimate journey shared among the patient, her support team, and nursing staff. Unique to labor and delivery, we often have little time to introduce ourselves before we are needed to assist in the delivery of their precious baby. The bond and trust that we are able to establish with our patients in a short amount of time allows us to do the most awesome thing in the world, deliver babies. We have the privilege of making a significant impact on our patients' lives. We are there when they are scared and in pain. We are there when they suffer a loss. We hold their hands and cry both happy and sad tears with them. We continue to evolve, maintaining and improving things we have been doing, finding new ways to achieve nursing excellence. In conclusion, it may have taken one voice that equaled many. It may have been a small meeting among 5. It may have been one statement, let's do this the right way. But regardless of today's outcome, we are growing, we are winning. We are working together as a unit, as a collaborative of women's health entities. As an Abington Health representative of magnet status, we are one, we are foretold.